and always just look at her. when you're
Sure,
speaking.
yeah, okay.
Okay, I'm ready, so whenever you're ready.
Okay. Think of like an introduction, but so today we have Dr. Helmy with us today to talk about setting up a clinical learning environment. Thank you for coming, Dr. Helmy.
It's my pleasure.
So when you have a new team or you have a learner join your team, what do you do to set expectations and goals on that first day?
Usually I will briefly mention my way of rounding, and I try to set the stage by making them comfortable, making sure that they understand that I'm here to help them, help the process of seeing the patients, make sure everything is done well, and at the same time highlight that this is their opportunity to learn as much as they can. It will take a big part of it on their efforts and on myself setting the stage, making sure that I meet the requirements of seeing patients in a timely manner, getting the work done, but at the same time encouraging them to always ask, not leave things unsure of or not clear. And that's basically what I said on the first day. You are here to learn. I'm here to support you and help you get the work done and get you learn as much as possible. And the more you are ready as a sponge to absorb, the more I'm going to be able to feed you. So.
Wonderful. And do you have them set specific goals for their own learning, or do you provide goals for them?
I really basically, without knowing each one where they stand at their stage of how strong, whether this is the first rotation in the year, whether this is really at the end of their third year, for example, it depends. But just the first day, it's hard to get a feel. It's just an open invitation to feel relaxed, and they can ask without feeling intimidated, and at the same time, this is an opportunity for you to gain as much as possible, making look like you are going to win something, and it's up to you whether it's going to be small or big.
Wonderful. So maybe setting up the learning environment first, and then once they're comfortable, they can set some goals
For themselves, exactly. And then I will be able to guide them as I know where they stand, at the stage of their learning.
Very good. Sometimes on busy days, some of the junior team members can feel left behind, but at the same time, some of the senior team members can get frustrated with time spent teaching when things are really busy. Is there a particular way you structure your rounds or your day to promote all team members staying engaged?
Yes, I have to be sensitive to the patient's load, and that's really what helps me sometimes to decide if I'm going to do walking rounds versus sitting rounds. So if I have a big service, usually what works the best is sitting rounds. So the patients will be presented to me, usually by the students with some guidance and prodding from the residents. So I will be able to do some teaching points, not really dedicate a whole 10 minutes on every patient to teach, but as they present, I will highlight points in the complaints, in the presentation, in the physical exam, in the labs that will be like pearls on every patient. At the same time, my resident can turn around and put orders as we speak, so we go from one patient to the other. I am able to provide feedback to the residents, to the interns, at the same time teaching the med students who will benefit from those tips, and at the same time not to be a barrier again in the way of getting the work done for the team. So it seems that you can always gear it to the different levels and make sure that it's not my job only as a teacher, but as an attending, I am attending to the team, to the needs of the patients as a priority, and the needs of my trainees when it comes to teaching as well. And the key is how to balance them. So
That sounds like a great strategy. How do you ask learners questions without seeming intimidating?
So basically, I always ask questions, but I don't ask questions of a particular individual. So I will present the questions and make sure I look in the faces and not really pick on certain person. But usually, if there is somebody is comfortable and know the answer, they will step and provide it. So without putting any one of them on the spot, I present the question. It helps two ways. Number one, get them into the discussion. At the same time, it will give me the opportunity to figure out where the need is. So I will present the questions, wait a little bit without really pointing to a certain individuals, and then I will provide the answer. At the end of that discussion, those who didn't know it will gain the knowledge, and those who did, I didn't really take away from them the chance to prove it without intimidating any of the listeners.
Oh, very good. What qualities have you tried to emulate from your own role models?
That's a very good question, because I believe that professionalism is not taught in classes,
Right.
but it's actually absorbed and grasped from people that we respect, and we have really a strong feelings that we want to be like this person. So the caring, that's something I cannot teach. I can teach medicine, I can teach endocrinology, but I cannot teach people to care. So this is seeing the caring, that I need to stop and be with the patient as long as the patient needs. That's caring, regardless of where I am in the numbers of patients that I'm seeing, or where I am in the number of notes that I have to write at the end of the day. I think caring is something that the students, and the earlier the stage of their training, need to see. We are not employees, we are professionals. We are there as long as the patient needs us. I'm not signing in and signing out. I am there because my patient needs me. And I think that's what I really want my students to learn first. And then how to get the work done. Not necessarily to meet a deadline, but to get the patients better, to get where my goal is. What is my goal for this patient? And sometimes the goal for my patient is a cure, and sometimes it's not. It's making him comfortable. Whatever the goal that I think is ideal for the patient, how to get there in a caring way, that's what I think the students need to learn. The earlier they get it, the better. And that's something they will never get in a classroom. They will get it from watching somebody they respect. And at the same time, they are not afraid of. They are not afraid to ask. They are not afraid to approach. And if I'm very bright, but I'm